You know how for centuries map makers used to draw those terrifying sea monsters in the blank spaces of the ocean?
Oh, yeah, because admitting they simply didn't know what was out there was just too uncomfortable.
Exactly. They'd just ink in a giant kraken and literally write, "Here be dragons."
Right.
And today, we tend to think of the human body like a modern, fully rendered satellite map. Like, we assume every square inch has been documented,
Yeah.
categorized and universally agreed upon by science.
Yeah, like if you break an arm, the x-ray shows the radius bone, the doctor points to it, and it's just a settled, indisputable fact.
Right. But the moment you step into the world of female sexual anatomy, it's like suddenly the medical community is drawing sea monsters again.
Oh, for sure. The landscape gets incredibly murky very fast.
Yeah, the scientific consensus just fractures,
Yeah.
and yet the commercial industry is moving full steam ahead into those blank spaces. So today we are diving into the booming, controversial world of intimate aesthetics.
It is a massive industry right now.
It really is. Specifically, we're unpacking a procedure that's marketed as the G-Shot. If you've been seeing ads for this and wondering like what it actually is, how it mechanically functions inside the body, and why it's at the center of this huge scientific debate, you are absolutely in the right place. Okay, let's unpack this.
And we're pulling from a really dynamic stack of sources for this deep dive. On one side, we have the official clinical guidelines, position papers from major medical bodies like the American College of Obstetricians and Gynecologists.
The big hitters.
Exactly, the FDA, the NHS over in the UK. But we're contrasting that medical consensus with investigative journalism from VICE and the Science Media Center.
Which gives a totally different perspective.
It does. And crucially, we're looking directly at the promotional materials and the anatomical claims made by the actual cosmetic gynecology clinics selling these procedures.
Because you have this massive friction, right, between the wellness industry, which is just sprinting forward with these treatments, and the peer-reviewed science, which is waving a lot of red
A
flags.
lot of very bright red flags.
Yeah. So we want to figure out if a quick, 10-minute injection can truly alter human anatomy and guarantee sexual satisfaction, or if it's just a commercial quick fix for a highly complex system that we honestly barely understand.
Right.
Where do we even begin with the G-Shot?
Well, to understand the treatment, we first have to look at the deeply contested anatomy it's targeting. We're talking about the G-spot.
Ah, the famous G-spot.
Absolutely. Named after Ernst Grafenberg, who's a German gynecologist. He published observations about this sensitive internal zone way back in the 1950s.
Okay.
And culturally, it's been described as this highly sensitive, distinct erogenous zone located about 5 to 8 centimeters up the anterior or the front vaginal wall.
But the clinical literature we're looking at is so interesting here because it points out that the G-spot isn't actually a spot at all. Like, it's not a distinct standalone button.
No, not at all. It's not a separate organ waiting to be pushed. It is much more accurate to describe it as a functional zone.
Okay, zone.
Yeah. In the medical literature, it's often referred to as the clitoretrovaginal complex, or the CUV complex for short.
Clitoretrovaginal, that is a mouthful. What does that actually encompass?
Think of the anterior vaginal wall as a highly dynamic, multi-layered intersection. You have the internal roots of the clitoris, known as the crura.
Right, which go much deeper than people realize.
Exactly. They're these erectile tissues that engorge with blood. Then you also have the female prostate, also known as Skene's glands, which surround the lower end of the urethra.
Wow, okay.
And all of these structures interact with the urethral sponge and the vaginal wall itself. It's this highly vascular, nerve-rich network of entangled tissues.
Oh, wait, so if we try to visualize this, it's less like finding a standalone tree in the middle of a forest and much more like, I don't know, stumbling upon a massive interconnected underground root system.
That visual captures the biology perfectly. It's all entangled. And because it's an entangled root system rather than a single tree, the scientific community literally cannot agree on a definitive anatomical map.
Which is wild to think about.
It is. The sources highlight this intense, ongoing debate. Like, for example, researchers at the University of L'Aquila in Italy conducted this really fascinating study using transvaginal ultrasound.
Oh, ultrasound. What were they looking for?
They wanted to see if they could physically measure a difference in women who consistently experience vaginal orgasms versus those who don't.
How do you even measure that with an ultrasound? Are they looking for blood flow or actual tissue density?
They were actually measuring the physical thickness of the urethrovaginal space, that specific tissue layer on the anterior wall.
Oh, interesting.
Yeah. And the ultrasound showed that the women who reported experiencing vaginal orgasms had a statistically thicker urethrovaginal space.
No way.
Yeah, so the researchers argue this proves a distinct physical difference exists in the tissue structure of that zone, which to them validates the biological reality of the G-spot.
But the sources also cite prominent skeptics, right? Like Professor Tim Spector, and they look at that exact same region and draw a completely different conclusion.
It's exactly. Professor Spector argues that this thicker tissue is simply the internal extension of the clitoris.
So he's saying it's not a separate G-spot zone at all.
Right. He's saying it's just the deep roots of the clitoris being stimulated through the vaginal wall.
Yeah.
It's not its own distinct entity.
And while scientists are arguing over ultrasound imaging, the sexologists in our sources are warning about the very real psychological fallout of this whole anatomical debate.
Oh, the psychological impact is massive.
Yeah. This intense cultural obsession with locating the mythical G-spot makes so many women feel like dysfunctional if they can't find it.
Or if they just don't experience intense pleasure from that specific area.
Exactly. And the medical consensus across the board is that not experiencing G-spot pleasure is entirely normal. Doesn't mean anything is broken.
Not at all.
I'm struggling with the logic here, though. How can the medical and cosmetic industries offer a highly specific, trademarked treatment for an area when scientists are still literally debating its exact map? It seems like, I don't know, selling a renovation for a room and the architects aren't even sure it's on the blueprints.
What's fascinating here is that where precise anatomical consensus is lacking, the cosmetic industry rarely waits for a settled textbook definition.
They just move ahead anyway.
Pretty much. They see a gap in patient satisfaction, and they engineer a functional mechanical workaround based on symptoms.
Right.
If patients are asking for more sensation in that general area, the industry just looks for a way to forcefully amplify the physical contact with that underlying root system, regardless of what the textbooks call it.
And that mechanical workaround is the G-shot. So let's get into the mechanics of what this procedure actually does. It was invented by a gynecologist named Dr. David Matlock, right?
Yes, and clinically, you'll see it called G-spot amplification, or anterior vaginal wall augmentation.
Okay, anterior vaginal wall augmentation. So what does the actual procedure look like?
It's entirely non-surgical. According to the promotional materials from various clinics, a patient comes in for a session that takes roughly 10 to 30 minutes.
So very quick.
Very quick. The clinician uses a speculum to open the vaginal canal, applies a local anesthetic to numb that anterior wall, and then uses a needle to inject a dermal filler directly into the submucosal layer of the tissue.
We should define that layer because it's totally crucial to how this works. The submucosal layer is essentially the spongy connective tissue that sits just beneath the surface membrane of the vaginal wall. Right?
Exactly. It is very rich in blood vessels and nerve endings.
And the filler they're injecting into it is usually cross-linked hyaluronic acid, or HA, which is the exact same biological compound used in facial and lip fillers. Or sometimes they use processed collagen.
Hyaluronic acid is really fascinating biochemically. It's a naturally occurring sugar molecule in our bodies that binds to water. It acts kind of like a lubricant and a shock absorber.
But in its natural state, it's a liquid, isn't it?
It is. But cosmetic fillers use cross-linked HA. They use chemical bonds to tie the long HA chains together, which turns it into a stable, durable hydrogel matrix that actually holds its shape inside the body.
So they inject this highly structured gel into that submucosal layer, and the goal is purely mechanical. Like it creates a physical bump roughly the size of a quarter and about a quarter-inch high.
Right.
So the internal volume of the vaginal canal decreases at that specific point because you've added bulk. And that physical projection leads to increased friction during penetrative intercourse.
That increased friction is designed to force greater activation of the mechanoreceptors in the tissue.
Mechanoreceptors meaning?
They're the specialized nerve endings that translate physical stretch and pressure into electrical impulses. Those impulses then travel via the pudendal nerve up to the brain, registering as pleasure.
Here's where it gets really interesting. If we think of this like a road, the G-shot is basically just installing a physical speed bump on a smooth surface, just to ensure the tires actually feel it as they drive over.
That's a great analogy. You are forcing contact by artificially raising the terrain.
We need to differentiate this from the O-shot, though, because if you're researching intimate aesthetics, you will absolutely see them marketed side by side, but they use entirely different mechanisms.
They do.
Yeah.
The G-shot is fundamentally about amplification, using synthetic bulk to create physical friction. The O-shot, on the other hand, is marketed as rejuvenation.
Rejuvenation, okay.
It relies on platelet-rich plasma, or PRP. So a clinician draws the patient's own blood, spins it in a centrifuge to isolate the plasma, which is highly concentrated with platelets.
And platelets aren't just for clotting blood, right?
Mm.
They're packed with specific proteins called growth factors, like vascular endothelial growth factor.
Precisely. When that PRP is injected into the clitoris and the upper vagina, those growth factors are theorized to trigger angiogenesis, which is the creation of new blood vessels, and neurogenesis, which is the regeneration of nerve endings.
So it's not a speed bump at all.
No, the O-shot doesn't create a physical bump. It aims to chemically signal the tissue to heal or enhance its innate sensitivity over time.
And the attempt to wake up this tissue isn't just happening with needles. We have this great piece of medical journalism in our sources from Vice, where a writer actually tested out topical alternatives, specifically a serum called OMG Spot.
Right, the topical market takes the exact same goal and applies chemical mechanisms rather than physical or plasma-based ones.
What's actually in a serum like that?
That specific serum uses ingredients like peppermint oil, which contains menthol. Menthol actually binds to the cold receptors in our skin, confusing the local nerves into firing and creating this artificial cooling tingle.
Oh.
It also uses L-arginine, which is an amino acid that triggers the nitric oxide pathway to dilate blood vessels, essentially forcing local blood flow to the area.
The Vice writer noted that while using the serum, her G-spot felt noticeably spongier and easier to locate, like the vasodilation from the L-arginine literally clumped the tissue.
Right.
And the menthol allowed her to enjoy prolonged stimulation that was usually too intense or rough to handle. It really shows this massive spectrum of mechanical and chemical attempts to target this tissue.
It's quite a range.
But I have to push back on the core premise of the G-shot speed bump. I mean, orgasm is an intensely psychological and neurological event, right?
Absolutely.
Sticking a physical bulk of gel into the tissue feels like trying to fix a complex software issue with a hardware hammer. Does a physical speed bump actually translate to enhanced neurological pleasure?
That exact disconnect is where the divide between the commercial clinics and the major medical bodies turns into a massive chasm. The clinical evidence supporting that hardware hammer theory is virtually non-existent in rigorous literature.
But if you look at the websites of these intimate aesthetic clinics, you'll see citations of a pilot study claiming that 87% of women reported enhanced sexual arousal and gratification after getting the G-shot.
Yes, you will.
You'll see these glowing 5-star Google reviews calling the procedure life-changing. If the medical bodies are screaming stop, how are these clinics keeping their waiting rooms full?
Because anecdotal patient satisfaction is incredibly powerful marketing, even when it lacks scientific controls. But when you consult the official guidelines from the FDA in the US or the NHS and NICE in the UK or ACOG, the narrative completely flips.
What are they actually saying?
These bodies state unequivocally that there is no robust, independent, double-blind, peer-reviewed clinical evidence to support the efficacy of the G-shot.
Yeah, ACOG published a position paper way back in 2007 warning that there is, quote, no valid medical reason to perform the procedure. And they stress that it is entirely off-label and experimental.
Right. Because injecting hyaluronic acid into the vaginal wall is considered an off-label use of that filler. It was approved for facial wrinkles, not the submucosal layer of the CUV complex.
Right.
And beyond the lack of evidence, patients need to understand the physiological realities of the procedure itself. First of all, it is temporary.
Because our bodies produce an enzyme called hyaluronidase, right, which constantly breaks down our natural hyaluronic acid. And it turns out it attacks the synthetic cross-link filler, too.
Exactly. The body naturally metabolizes that filler over time, so that quarter-sized speed bump dissolves within 4 to 6 months, sometimes stretching to 12 months, depending on the patient's specific metabolism.
And at a cost of anywhere between $1,000 and $2,500 per shot, maintaining that artificial terrain requires a huge recurring financial investment.
It really does.
Plus, clinic websites often market this as a quick, lunchtime procedure with minimal downtime. But we are talking about injecting a foreign substance into a highly sensitive vascular root system.
Yes. The sources list potential complications like dyspareunia, which is clinical speak for pain during sex, as well as bleeding, infection, altered sensation, and scarring.
And there's also a very specific anatomical risk directly related to where the filler is placed, right? Urinary retention.
Yes, because the submucosal layer of the anterior wall sits directly against the urethra. If the clinician injects too much filler, or if the tissue reacts with excessive inflammatory swelling, that artificial speed bump can compress the urethra.
It essentially blocks the plumbing.
It can make it incredibly difficult or even impossible to pass urine for the first 24 to 48 hours until the swelling subsides.
Oh my God.
Interestingly, urologists actually use a very similar bulking mechanism intentionally. They inject synthetic fillers near the urethra to treat stress urinary incontinence.
Wait, to physically narrow the urethral opening?
Exactly. So urine doesn't leak when a patient coughs or sneezes. So the mechanical reality of bulking that tissue is proven. But in the context of the G-shot, compressing the urethra is a painful, unintended complication.
So we have 5-star reviews from actual patients saying this shot saved them sex life, and we have the entire medical establishment waving massive red flags saying it's unproven, off-label, and carries real anatomical risks. Who is right? How do those two realities exist at the same time?
This raises an important question. It really comes down to the critical difference between a satisfied customer and a controlled clinical trial.
Okay, unpack that.
A 5-star review is a genuine reflection of that specific patient's outcome,
Right.
but it tells us absolutely nothing about why they had that outcome.
Right.
Was it the physical friction from the hyaluronic acid, or was it the psychological effect of taking action, prioritizing their own pleasure, and perhaps communicating differently with their partner?
Because in a proper clinical trial, you would give half the women a placebo injection, maybe just saline, to rule out those psychological variables. But in the commercial wellness space, those rigorous double-blind trials simply don't exist. Which brings us to the powerful marketing engine driving the intimate aesthetics industry. The gap between the clinical data and the consumer demand is being aggressively filled by advertising.
The commercialization of human anatomy plays a massive role here. The sources point out that terms like G-shot, O-shot, designer vagina, and vaginal rejuvenation are not recognized medical nomenclature.
You won't find them in a Gray's Anatomy textbook.
No, you won't. They are commercial trademarks. They are marketing terms legally protected to sell a product.
The sources note the unbridled advertising of these procedures on social media, and it represents this fundamental shift in how we view medicine. Like, it redefines the patient as a consumer, dragging gynecology out of a healing medical model and into a purely commercial retail model.
And we have to look at the psychological mechanics of that advertising. When a clinic constantly markets a quote-unquote solution for the G-spot, it implicitly reinforces very narrow sociocultural messages about what female anatomy should look like and exactly how it should function.
Yeah.
Telling someone they need a specific shot to experience an orgasm can inadvertently create performance anxiety or body dissatisfaction in women who previously felt completely fine.
It frames natural variation as a medical deficit. It literally creates a problem so it can sell you the cure.
Precisely.
But we also can't ignore the placebo effect, which is scientifically documented and incredibly powerful, especially when it comes to the neurobiology of sexual medicine.
Sexual function is vastly more complex than a mechanical friction equation. Arousal requires the brain to downregulate the sympathetic nervous system, the fight or flight response, and engage the parasympathetic nervous system, which governs rest and digest, or in this case, physiological arousal. When a patient spends $2,000 on a G-shot, they are highly motivated for it to work. That financial and physical investment might act as a massive psychological permission slip.
It lowers their cortisol, focuses their attention on their own pleasure, and changes the relational dynamic with their partner. So the intervention itself changes the mindset, which directly changes the neurobiology.
Exactly.
So what does this all mean? Are these intimate aesthetic clinics exploiting women's insecurities with unproven science? Or are they providing a valid, empowering option for women who feel historically ignored by traditional medicine when it comes to their sexual pleasure?
If we connect this to the bigger picture, the reality highlighted in the sources is that it's likely a bit of both. Historically, mainstream medicine has had a massive, documented blind spot regarding female sexual pleasure and pain.
For decades, women's complaints were dismissed as purely psychological.
Right. And commercial clinics are eagerly stepping into that historical void.
Yeah.
They're validating those concerns and offering concrete solutions. But they're doing it for a steep price, utilizing experimental off-label methods that severely outpace the safety data.
It's an incredible intersection of anatomy, commerce, and psychology. Let's briefly recap the journey we've walked today. We started in the murky, debated anatomy of the CUV complex, exploring how the true physical nature of the G-spot is still argued over by researchers wielding ultrasound machines.
Yeah.
Then we looked at how the G-shot attempts to bypass that debate by mechanically amplifying pleasure, injecting hyaluronic acid into the submucosal layer to build a temporary physical speed bump.
We also examine the stark warnings from major medical bodies regarding the off-label use of these dermal fillers, the lack of rigorous placebo-controlled trials, and the real anatomical risks involved, from dyspareunia to urinary retention.
Right.
And finally, we explored the potent marketing engine driving the intimate aesthetics industry, analyzing how trademark terms and the neurobiology of the placebo effect keep demand high despite scientific skepticism.
We want to remind you that human sexuality is vastly complex, highly individualized, and deeply holistic. If you or someone you know is navigating challenges with sexual satisfaction or considering a procedure like this, the clinical sources strongly recommend exhausting first-line therapies before turning to injectables.
This includes options like pelvic floor physiotherapy, psychosexual therapy, or simply exploring different stimulation techniques.
And if you do decide to explore an intimate aesthetic procedure, it is vital to consult a highly qualified GMC or FDA-registered clinician. Go into the consultation fully informed, understanding the anatomy involved, and recognizing that this is an elective, temporary, and fundamentally experimental procedure. We started this deep dive talking about those old maritime maps, the ones with the blank spaces and the sea monsters. It turns out our map of the human body still has a few of those blank spaces left, especially when it comes to female pleasure. Which leaves you with a final thought to mull over as you go about your day. If our fundamental understanding of human anatomy is still evolving, as we clearly see with the ongoing fierce debates over the exact nature of the CUV complex, what other undiscovered or misunderstood areas of human physiology are currently being ignored by mainstream science, only to be commodified and trademarked by the cosmetic industry before we even fully understand how they work?